30 minutes a day of strenuous activity can reduce our rate of breast cancer by 20%. Diagnosis of cancer in general can make patients feel very vulnerable. And being able to support them through that journey gives me a great sense of satisfaction. And all I could hear in the background was the sound of gunshots. And suddenly that sense of security and peace was gone. You could either fall or you could thrive. I just felt like this is my forever home.
What's the one message you would like for women of Australia to hear? Hey, I am Alina Reddy and welcome to Foreign Influence.
It was a wild experience.
Something clicked in me and I didn't want to be average anymore. What I love about the Dragon is
How did that come about? Well, educated.
So he survived for about an hour.
Best Young Emerging Actor.
Oh, wow.
It has to be on point.
Yeah, yes. A particular sketch with Rebel Wilson.
Never stop learning.
I decided to run away.
Here I am, continuing my tennis journey here.
Thought, that's it?
A few opinions about what
Passages.
That made your journey harder? Hey, this is Alina Reddy and welcome to Foreign Influence. Today we're going to have a chat to someone very inspiring who arrived in Australia as a child refugee to become one of the leading Australia's breast cancer surgeons, Dr. Jasmina Kevric. Jasmina, thank you so much for taking the time and for having a chat with us.
Thank you for inviting me, Lina. It's a pleasure to be here today with you.
You have such an amazing life story from a refugee, Bosnia Herzegovina, to a leading Australian breast cancer surgeon. Does that feel real to you?
At times, I wake up and I think, gosh, I remember where I came from and the experiences that I've gone through, and to now live in this amazing country and to have the privilege to live here in peace and security is at times surreal, but it gives me great pride to be Australian.
Please tell us a little bit about your childhood.
When I was growing up in Yugoslavia, it was a wonderful childhood. For the first 5 years, I was surrounded by friends, family. We had security, we had love. There's nothing that you could have asked for in that environment. It was a wonderful upbringing, and I think it was very important for me to have that in the beginning, because what came after that was the war. And so, it didn't feel like I was not growing up surrounded by love and family. So that was always the most important for us. But certainly when the war started, you could sense a shift in, how everyone felt around you. And suddenly that sense of security and peace was gone. And you could see how fear and loss started to creep into not only our family, but into the society. And so you very early on got to understand what, death was, what, loss was. And I think
And you were so young.
Yeah.
And to have that trauma so young.
That's right. And, I don't think children should be really exposed to that, but this is the world we have. You learn very quickly to adapt to that as well. And I think that it taught me a lot about human nature, that regardless of what situation you're in, you adapt to the situation. And as children, remarkably, we adapt very quickly as well. I knew that was our new sort of world that we've been thrown into. But the most important what I found was we were still surrounded by love and family. And that is the main thing that got us through and out of the war.
What are your memories of the war erupting? So it would have been 1992?
That's right. So 1992, there was a lot of talk about, the war starting. But I think because we lived in Europe at the time, and Yugoslavia was very prosperous at the time as well, no one really took that sort of warning seriously. And people were just going on with their everyday life, going to work. So one morning when we heard the bridge collapse and the airplanes started coming in, it became very real. And that's when the faces on my parents, changed. You could see the fear. And I remember that sound distinctly, and I remember how dark it was. And that my parents grabbed my brother and I, and we got into the car and drove inland. And all I could hear in the background was the sound of gunshots. There is a lot of luck that played in how we got out of the country.
Yeah, in your survival.
In our survival. And you really have to have faith and hope at times like these, that you will, as a family, make it through. And once we got inland, we were with other extended family. And that's where the rest of the sort of Bosnian army got involved, and they created a barricade between enemy forces and us. And then we were able to sort of have a breather and decide where to go from there. But in the background, that was always the gunshots. You hear the airplanes circling, dropping the bombs, and then you hear the missiles coming through. And I remember one morning all the adults went outside and they started digging. There was this big hole that they dug up, and it was a bunker that they created for all of us in that town, so that when the missiles started coming in, we could just run and hide in the bunker. And I still remember so many days where we would sit in that bunker. It was cold, it was wet, it was raining outside, and you would all sort of snuggle in together and wait sometimes for days for the siren to stop. And that was, my childhood for the next 4 years.
When you are preparing for surgery, what goes through your mind?
Yeah, so there is that moment, it's called the scrubbing phase, where the patient is inside the operating theatre and the anaesthetist is preparing them, intubating them for the surgery. And that 5-minute moment before I go into the operating theatre to remove a cancer is my moment where I can take a breath, understand that there is a patient on the table with family who love them, and that it is my absolute privilege and duty to do the best that I can for that patient. So it gives me that moment of the sense of responsibility that I have, but also to understand that I have completed 25 years of training and that my competency and capability is there. It is that responsibility and acting on that trust that the patient's provided to me that gives me the strength to do what I need to do.
Jasmina, why did you decide to become a surgeon?
Surgery to me was always a way to have that immediate impact on someone's life. The seeds were dropped very early on in the war, actually. One day we were in our backyard and the missile struck the house, and a lot of my family members got hurt and wounded. There was a lot of blood. And I saw the medics coming from the makeshift hospital and working on my family, trying to save them, trying to stop the bleeding, and then take them to the hospital where the surgeons worked again to make sure that they could survive, and they did. And so it created that first impression on me of what significant impact a surgeon, a medic, can have on someone's life, because without them, my family wouldn't have survived. And so I knew very early on that's what I wanted to do. And for me, surgery has always been not only a passion and interest, because I deeply find it exciting and interesting, but because of the impact it does have on the patients, so direct impact. And I wanted to be able to provide that for the rest of my life.
That is incredible. It just shows what a strength of character you have, the backbone, instead of being paralyzed by trauma, but it actually gave you that boost.
Yes.
To do something amazing with your life.
Yeah.
And to save so many other people's lives.
Yeah, Elena, I think there is that fine line where you walk. You could either fall or you could thrive. And it does take a lot of determination to get through that, but it also takes a lot of people in your lives to push you along. You know, and I think without family, without friends, it would not be possible. Because on my own, I certainly, would have struggled to get through that as well.
Why did you decide to specialize in breast cancer surgery?
Breast cancer surgery is a field where not only do you use your technical abilities and your artistic skills to reshape the breast, but it also has that emotional and deep connection with the patients when they're going through the most difficult aspects of their lives. You know, diagnosis of cancer in general can make patients feel very vulnerable. And breast cancer is something that most women feel very emotional about. And being able to support them through that journey and seeing them come out of that is something that gives me great sense of satisfaction, but also just seeing the patients feel their sense of self after that diagnosis is just so phenomenal to see. And I'm very lucky to be able to be in this profession.
As the breast cancer specialist, what's the one message you would like for women of Australia to hear?
The most important is that early detection of breast cancer is the key. So we know that Australia and New Zealand have the highest rate of breast cancer in the world. And although it is the highest rate in the world, we also have one of the best outcomes in the world because of our fantastic healthcare system. But we can do better. And early detection is really the key. And we know that if we detect breast cancer early, women have up to 95% chance of having 5-year survival rates. So the rates are excellent in those who have early detection. What Australia does in terms of providing that screening program is through the breast screening program and provides women with free mammograms. So every year or 2 years, women have the option of having a mammogram for free. And currently there is an uptake of about 50 to 60% of Australian women who attend to the breast screen. And I think as a society we should and can do better. And I would encourage every woman in Australia to have their mammogram if they're over the age of 40 and have that chance of early detection. But beyond that, it's also about prevention of breast cancer. So we know there are lifestyle factors and estrogen factors that can contribute to breast cancer. Particularly with the lifestyle factors, things like obesity, inactivity, and alcohol are one of the key factors that increase breast cancer rates. If we can modify that by reducing the amount of alcohol we drink, because we know that no amount of alcohol is safe when it comes to breast cancer. If we can reduce the amount of obesity that we have in the society, because we know in postmenopausal women that obesity can drive estrogen, which can then increase the rate of breast cancer-related estrogen cancers. So if we can reduce that, then we can reduce the breast cancer rates. And we know that 30 minutes a day of activity, of strenuous activity, can reduce our rate of breast cancer by 20% compared to those who don't exercise.
That is incredible.
So yes, so those are some of the simple ways we can work on reducing our cancer rates. And there are other factors that, as a society we probably might find it difficult, but pregnancy after the age of 35 has been shown to increase the rates of breast cancer. But we live in such a society where there's a lot of demands on women. And I think early detection comes back to that being the main factor. And being vigilant about one's breast. And if a woman has any concerns about a lump or changes in the breast, then just see your doctor or your surgeon.
You mentioned that Australia has, with New Zealand, the highest rate of breast cancer in the world. Yeah. Why do you think that is?
So it's a combination of an ageing population. And then with those modifiable risk factors I was talking about, and again, having that estrogen exposure, so women in their late 30s having children, there is a small risk with women going on a HRT that can also increase the breast cancer rate slightly. But really the most important is the age. We are an aging society, and with age, cancers are more likely to develop. But that again comes back to reducing it through early detection. And by using those modifiable risk factors as a public health initiative, we can certainly drive that down by reducing rates of obesity, reducing the amount of alcohol we drink, and then also having more physical activity in our everyday life.
Jasmina, how would you describe yourself as a person?
I'd say I'm a very determined, ambitious person who's very emotional as well. I value family above everything else. So, but I also understand the importance of doing what you are inspired to do in your life. And so I am very aspirational in that regard as well. But I can be a bit hard on myself, I'm very critical of the things I do at times because I want to be better, and grow and do well. So I always need to be mindful of that and just remember that doing my best is all I can do. So that's me.
When you arrived in Australia, what are your first memories?
Funny thing is, when I first arrived, it was during the time where it was Australia Day.
Okay.
And funnily enough, the airplanes started circling. Ooh. And I thought, and I had to duck because I was like, oh my God, we're being attacked.
Funny, but not funny. Yeah.
So when I think about it now, it's actually quite amusing. It just created that sense of excitement suddenly for me because, hey, this is about celebrating this country and how at peace we are. I think that was the greatest thing that I got from those first few, months is how nice it is actually to wake up every day and think, oh, wow, this is my new home and how wonderful it is. There's the beaches, there's the kangaroos, the people are so lovely. And there were people from all walks of life, and I could talk to friends who experienced the same things as me. We all all gathered in the Dandenong Noble Park area. So that was a nice, where you feel a sense of community. But also, the teachers and the community, how welcoming they were, and gave me attitude that I could do anything, that I could be anything in this country. I just felt like this is my forever home, and yeah, it's nice.
And also to fulfill your dream, becoming a medical professional.
Absolutely. I didn't know what the Australian system was like in terms of education. I didn't know how I would go about becoming a surgeon in Australia. All I knew was I needed to study, I wanted to do well, I wanted to embrace every opportunity that I got. And so it was just a natural sort of process that kind of led into medical school and then led into surgery, because I was just so keen to learn. And I was so hungry for knowledge. And having parents who are very big supporters of you and wanted you to do well, they didn't want you to do any housework. You just go and study, we'll do everything for you. We just want you to do well. And so I remember when I finished year 12 and I got my score, and then you go into the local milk bar and you get your newspaper to see which university and what degree you would get into. And I put medicine as a number one, but I didn't think I would get in. I looked at all of the other.
Didn't stop you from hoping.
It didn't. Yes. I always had the hope. But my career advisor at the time told me that I need to be realistic, that it's probably not going to happen because of, I didn't go to the private school, that I didn't have that, upbringing. I looked at all the other courses that I applied for and my name was nowhere there. And in the end, I was like, oh, maybe I got into medicine, I'll just check. And then there was my name there, and it was just such a surreal. I still remember that. It was that moment when I thought, oh wow, that girl when she was watching you know, that whole scene unfold, finally gets the chance to make a change in this life. So that was a very special moment.
You don't see a lot of female surgeons. Why do you think that is?
Yeah, surgery has always been a very male-dominated sort of field, and it's been like that for a long time. But there is change coming through. Currently, we have about 50% of graduates who are female coming out of medical school.
That's good.
It's phenomenal.
Yeah.
But there is this phenomenon also called the leaking pipe, where when they leave medical school, about 30% of students will become trainees of surgery. And then about 20% will become fellows, so a surgeon, and then 13%, 1/3, will become active surgeons. So there is this leaking pipe where we're losing women in the profession. And there's a lot of studies that looked at why that's occurring, what the causes are. And predominantly the main factors are, you know, long working hours, impact on family, the mental health associated with that, and harassment as well comes into play. And we know that 95% of our trainees are at the age of 30 or over. And that is the prime time for, you know, family planning.
Yeah.
So you have this environment where you're studying and working very hard to get through the surgical training program, because it is a very demanding career. But at the same time, you're trying to meet a partner, you're trying to preserve your fertility, and you're trying to have, you know, children. And balancing those two is incredibly difficult. And so we lose women for that reason. But change is occurring. You know, we have more and more flexible training options where you can do part-time training. And the culture is slowly changing, particularly because there are more women coming through. And we want to see that change. And we want to improve the lives of our trainees.
Jasmina, how do you juggle family life and the demands of surgery?
Yes, that's a very, very good question. You know, it's difficult. It's not perfect, but it's important to be done so that our younger colleagues, that it's possible. So my husband and I, we value working lives. And so in that, we support one another. When my husband has work commitments, I step up with childcaring. When I have work commitments, then he steps up. And I have extended family as well. My parents are very much my support network, and they jump in when we need to. It's difficult, and the mother guilt is prevalent. My daughter is very much understanding of what mummy does. You know, she knows that mummy saves lives, and she knows...
She must be so proud of you.
Yeah. So we were, last night I was presenting on parenthood, and she was there sitting with me, you know, watching mummy do the talk. And so she's, you know, very much engaged in what I do, and I always try and bring her into my work as well, so that she sees what I do every day and she understands.
How old is she?
She's almost 5 years old.
So she is the same age as you were when the war erupted.
That's right. And it's
wow.
incredible to see the contrast, you know, where I was and what an amazing upbringing she's having currently.
But also, obviously, you received some strong message, which you converted into positivity later in life. And she's receiving a very strong message as well right now by your example.
Yeah, I hope, you know, she is inspired by that in the long term. We want to show not only how important work is, but to do something you really value in your life.
I believe you have wonderful news. You're expecting your second baby.
We are. We're expecting our second baby and, you know, growing our family, which is very exciting. I know there are challenges ahead, and I'm excited to meet those challenges because I feel I've, you know, learned a lot throughout my last 30-something years. So I feel, you know, very excited to meet this one. And my daughter, Sophia, she's very excited to meet her brother, and it's going to be exciting for the family.
So much to look forward to.
Absolutely. So much to look forward to. And, you know, not just for my own family, but also for, you know, my surgical practice as well, where that's also growing, and, you know, welcoming to see patients as well. So there's just a lot of excitement right now.